নমস্কাৰ কি খবৰ আপোনালোকৰ মোৰ নাম ইজাজ আহমেদ স্যাৰ সাকে আপোনালোকে চিনি পাইছে আৰু পুনৰবাৰ আপোনালোকৰ সন্মুখত আজি মই উইকলি আসাম এনালিসিছৰ যোনটো আমি এটা নতুন প্ৰচেষ্টা CSAP একাডেমীৰ ফালৰ পৰা আমি আৰম্ভ কৰিছো হেতুলে উপস্থিত হৈছো হি and today the topics which I am going to cover in this particular session are number 1 India Post launches global first spectacles accessibility pilot initiative in state eta sosma pradan korar khub dhuniya initiative loi ahise India Post Assam Fixation of Ceiling of Land Holdings Amendment Act 2025 Sa baganar bhitor thoka sa shramik hokolok mati diar eta procesta loi ahise Assam sarkare Assam records sharp decline in cybercrime logot related aru fourth junto topic hetu is a rising HIV infections in Assam. So let's start today's session. So ebilak topics moi koisu India Post or eta topic Assam Fixation of Ceiling of Land Holdings Assam records sharp decline in cybercrime aru rising HIV infections. Iti ami eta tage pori jam. This is the first news, which is India Post launches global first spectacles accessibility pilot initiative in state. So, ghotna to ki, context to ki, India Post in collaboration with WHO India, Sri Sankardev Netralaya was SSDN, and Vision Spring, they have launched a global first pilot initiative named Post Office Delivers the Gift of Clear Vision. Naam to ki, Post Office Delivers the Gift of Clear Vision. This is the name. Okay, this is the name. Aru kot launch hoise at Khetri Post Office Kamrup Metro. Yat mon korbo logia kisman words ase. These are the keywords junbilak moi bold korisu. Pilot initiative are globally first. Mane launch hoise Okhomot. Okay, monot thobo. Okay, it aims to enhance access to press biopic spectacles. Press biopic spectacles mane kotha to hol jar sosmar actually jar proyojon besibhag manue hebilak manue sosmar mane access to poai na azileke. Jak actually proyojon হেবিলাক মানুহৰ যদি এটা আমি সংখ্যা উলিয়াও হে মানুহসকলৰ ভিতৰত বেছিভাগ মানুহে আজিলৈকে চশমা কিনিবলৈ সক্ষম হোৱাই নাই সো তেওঁলোকৰ কাৰণে এই ভিজনটো বা এই ইনিশিয়েটিভটো লৈ আহিছে okay it aims to enhance access to press biopic spectacles through post offices আৰু post officesৰ যোগেদি চশমা বিলোৱা হ'ব a non traditional but widely accessible last mile delivery network কিয় একেবাৰে যদি সিম্পল ভাষাত কবলৈ যাও আপোনালোকেও জানে চাগে পোষ্ট অফিচৰ নিচিনা নেটৱৰ্ক বহুত কম ইনষ্টিটিউচনৰ আছে একেবাৰে দূৰ দূৰণি থকা ৰিমোটেষ্ট কৰ্নাৰ্ছকো কানেক্ট কৰে পোষ্ট অফিসে সো তাৰে সুবিধা লয় তেওঁলোকে এই ইনিশিয়েটিভ লৈছে পোষ্ট অফিচৰ দ্বাৰা চশমা বিলোৱা হ'ব ওকে সো কি ফিচাৰ্স অফ দ্য ইনিশিয়েটিভ কি ফিচাৰ্স বিলাক কি এড্ৰেছ গ্লোবাল পাব্লিক হেলথ গ্যাপ মই কৈছোৱে ওকে যিমানটো সংখ্যা তেওঁলোকক যিমান বিলাক মানুহক চশমা লাগে হিমানখিনি মানুহৰ ওচৰত চশমা নাই সো হে গ্যাপটো ফুলফিল কৰিব only 1/3 of people who need spectacles receive them mane 2/3 napai okay 2/3 of people do not even get spectacles which they want improve accessibility to reading glasses and other low cost corrective spectacles bahut beshi high cost nohoy kintu junbilak reading glass buli ko ba low cost junbilak chashma he bilak available kora hobo unique approach utilizes post offices as non healthcare access points for air care products targets last mile populations especially rural and semi urban areas especially rural or semi urban areas bilakok target kora hoise okay institutional collaboration so kar logot collaborate korise India Post lead implementing agency hoise India Post it selects pilot locations and Sri Sankardev Netralaya has collaborated with India Post it provides technical leadership and clinical expertise what does it provide it provides technical leadership okay technicalism logot jorito আপোনালোকে নিশ্চয় নাম শুনিছে শংকৰদেৱ নেত্ৰালয় গুৱাহাটীৰ বেলতলাত আছে মস্ত ডাঙৰ বিল্ডিং আৰু অসমৰ বিভিন্ন ঠাইত আছে শংকৰদেৱ নেত্ৰালয় WHO India এ সাপোৰ্ট কৰিছে আৰু what is the role of WHO India it supports national and international coordination aligns with global refractive error strategies okay যেহেতু এটো এটা হেলথ সব তিনটা বেলেগ বেলেগ ডিপাৰ্টমেন্ট সমাই আছে বা তিনটা বেলেগ বেলেগ এৰিয়াজত ফাংশন কৰা ইনষ্টিটিউশন সমাই আছে পোষ্ট অফিস সম্পূৰ্ণ বেলেগ Sankardev Netralaya health aru WHO ako health mane Sankardev Netralaya expertise in matters of in optical matters boli kole bhul no hobo significance bridges gap in refractive care often neglected in public health discourse strengthens universal health coverage by integrating eye care services into everyday institutions promotes affordable preventive and accessible healthcare solutions affordable preventive and accessible healthcare solutions ok promote kore ei initiative to value added material for mains okay mains or karone ebilak bostu important hobo pare apnalokor karone reports and data WHO World Report on Vision 2019 এ কি কৈছে 1 billion people globally live with preventable or unaddressed vision impairment. Unaddressed মানে কি তেওঁলোকে যদি ইচ্ছা কৰে they can address it, কিন্তু তেওঁলোকৰ হে জ্ঞানখিনি নাই বা তেওঁলোকৰ ওচৰলৈ আমি যাবলৈ সক্ষম নাই কাৰণে it remains unaddressed. And we tend to correct this through this initiative. Only 1/3 of those needing spectacles receive them, as highlighted in discussions at WHO and United Nations. Constitutional backing. Our Indian constitution, what does it tell? How does it aim to address this particular issue? Article 47 talks about it. Duty of the state to improve public health. It is the duty of the state, duty of the country to improve the public health. Article 21, obviously right to health as part of right to life. Article 21 is about right to life and dignity, and right to life, right to health is a part of right to life, because if you are not healthy, what is the point of that life? Okay? Now, let's have a question. Eta proshno ami solve koru. Consider the following statements regarding the post office delivers the gift of clear vision initiative. Number 1, the initiative aims to distribute presbyopic spectacles through healthcare centers managed by state governments. Okay, the initiative aims to distribute presbyopic spectacles through healthcare centers. Absolutely not, because the entire distribution will be done by post offices. That is why post offices have been roped in, right? Sri Shankardev Netralaya is providing technical leadership. Yes, this is correct. This is correct. Assam has been selected as the pilot state for the global first rollout. This is also correct. So 2 and 3. So B is the right answer. Okay, B to Huddha hobo. Okay, B to Huddha hobo. Let's move ahead. Assam Fixation of Ceiling of Land Holdings Amendment Act 2025. This can be very, very important for the upcoming mains. Okay, let me remind you of that. Background ki hoy. The Assam Legislative Assembly passed the Assam Fixation Ceiling of Land Holdings Amendment Act 2025 on November 28th, enabling the state government to allot residential land within tea garden communities but within tea garden campuses to tea workers, addressing a long-standing demand of the tea tribe or Adivasi communities. Ji hokol sa kormosari ba sa baganor বা আমি যাক টি লেবাৰাৰ্ছ বুলি কওঁ, ওকে, চাহ জনগোষ্ঠীয় মূলক লোক যিসকল চাহ বাগানবিলাকৰ ভিতৰত থাকে তেওঁলোকক মাটি প্ৰদান কৰিবলৈ ওলাইছে অসম চৰকাৰে এই একখনৰ জৰিয়তে। কাৰণ তেওঁলোকে বহুত আগৰ পৰা কৈ আছিল যে আমাৰ কি হ'ব, উই অলছ' ৱান্ট চিকিউৰিটি ইন আৱাৰ লাইভছ। চ' তেওঁলোকক পাৰ্মানেণ্ট ৰেজিডেন্স এটা দিয়াৰ কাৰণে, তেওঁলোকক পাৰ্মানেণ্টলি মাটি দান কৰাৰ কাৰণে দিছ এক্ট হেজ বিন পাছড। কি প্ৰভিজনছ কি হয় এমেণ্ডমেণ্টৰ? আগৰ পৰা আছিলে এমেণ্ডমেণ্ট, নাও দিছ হেজ বিন, মানে আগৰ পৰা আছিলে আইনখন, নাও ইট হেজ বিন এমেণ্ডেড। allows land settlement for tea garden workers living in labor lines. Okay, tea gardener bhitorot sa baganer bhitor labor lines bilak thake je, he labor lines bilakot thoka hobo lagibo, mane ex tea garden sa baganer bahirot thoka sa jonogostiyo mulok lok hokole benefit to napaye. Okay, ami jak XTGL বুলি কও, তেওঁলোকে এই benefit to napaye। sa baganer bhitorot labor lines or ji hokol ase, okay, sa baganer কৰ্মচাৰী সকলৰ কাৰণে এই particular initiative too. Over 3,33,486 tea workers families will receive land rights. Okay, more than 3 lakh tea workers will receive land rights through this initiative. Total land to be transferred 2,18,533 bighas across 825 tea estates. Okay, across 825 tea estates, more than 2 lakh bighas of land. Aims at giving land security, obviously, thereby improving dignity, social recognition, stability. Hoy na mati thakile social recognition thake, মান সন্মান থাকে, stability থাকে। Significance of the move, obviously socio-economic empowerment, to make them strong as a community. Okay, to make them strong as a community, to make their lives secure, to make their future secure. And centuries old landlessness among tea tribes provides land titles, okay, patta, matir pata boli ko je ami okhomiyat, which enhance credit access, housing quality aru social mobility. Okay, historical justice, yes, tea workers have contributed for over 200 years to Assam's tea industry. Okay, আজি যদি অসমক চিনি পায় গোটে বিশ্ব দৰবাৰত অসমৰ নাম আছে, কেবাটাও কাৰণে নাম আছে, কিন্তু আটাইতকৈ ইম্পৰ্টেন্ট কাৰণটো হৈছে চাহৰ কাৰণে। চাহৰ লগত যিসকল মানুহ জড়িত হৈ আছে তেখেতসকলৰ কথা চিন্তা কৰাটো আপোনাৰ আৰু মোৰ দায়িত্ব হয়। Okay, আমি তেওঁলোকক একাখৰীয়া কৰি দিব নোৱাৰো। So one of the state's most profitable sectors হয় tea industry. It recognizes and compensates for chronic marginalization. At the same time, Sahor industry logot eta bahut agore pra eta problemo jorito hoy ase je ei manu okolor karone we haven't done enough. Agote British exploit korisile. They have been the victims of a large scale exploitation, and they have been exploited for long. So jodi teolokor bhalor karone kiba eta hobole goi ase apuni aru moi support koribo lage. But because this community, history tells us, this community has been exploited for long, okay, by the British for various reasons. And till today they have been exploited. Okay, today if I have to tell you the exact reason, till today they have been exploited for various reasons. Some people exploit them for political mileage, some people exploit them for something else. So this initiative will definitely give them a boost. Okay, this initiative will definitely secure their future. Okay, so this is a very good initiative. But obviously, as we shall see, this initiative, like any other initiative, has got its own challenges. It has got its own share of challenges. Political and governance impact. Considered a political strategy ahead of elections. Okay, many people are saying that it is nothing but a political gimmick because elections are right around the corner. It is just a heartbeat away. They are the doorstep. So, Sarkare enekwa eta podhokhep lobole hoikhom hoise because in Assam, the tea garden community, it is a major vote bank. It is a major deciding factor as to which political party will come to power. Okay, strengthens state worker relations and reduces labor unrest. Okay, it will also reduce labor unrest. Challenges and concerns, delay due to tea planters. So this will not be taken lightly by the tea planters. This is something which hasn't gone down very well with the tea planters. Okay, because the garden belongs to them and they will not be in a very comfortable position sharing their lands with so many people. Okay, planter associations have set conditions before land transfer. So they have put forward their own conditions. They have put across certain terms and conditions, and it has gone on to delay the patta distribution. Hekarone aru olop somoy lagibo. Okay, gote process to delay hoy goise. Persistent socio-economic issues. Tea garden workers continue to face poor healthcare access, violations of the Plantations Labour Act 1951. It has been thoroughly violated even after India's independence. High burden of preventable diseases, malaria, gastroenteritis, those diseases which have by and large been controlled in other parts of the country or other parts of the state, they have not been controlled yet in the tea gardens. That's how bad things are. As if we have forgotten those people, as if we have relegated them to the lower section of the society, which should not have been the case. Okay, acute child malnutrition and anemia among women. This is a very major problem. Child malnutrition, because children are tomorrow's future. If they are not healthy, okay, then we can say that the future is not in a very good shape. So it is our duty. The onus is on us. High IMR and MMR in tea garden areas. Infant mortality ratio and maternal mortality ratio. These are the two issues which are very high in tea garden areas. Okay, right after giving birth, many of them die. Or infant mortality rate, and all these are happening because of poor healthcare inside the tea gardens. Okay, way forward, strict enforcement of the Plantations Labour Act. So this way forward is about how to improve the conditions of those people. So this way forward is not just about this act, but in general. Okay, what we should do to improve the conditions of those people. Robust public health interventions in tea estates. Nutrition focused schemes like Poshan Abhiyan must be effectively implemented. Improving education, sanitation and women's health. This is also very important. Improving education, sanitation and women's health. Okay, data reports. Tea tribes constitute 17% of Assam's population. That's huge. 17% তেওলোকৰে মানুহ আছে অসমত. Assam contributes আৰু 50% কৈও বেছি production, মানে ইন্ডিয়াৰ পৰা যোনটো চাহৰ উৎপাদন হয়, চাপাতৰ উৎপাদন হয়, তাত 50%কৈও বেছি শেয়াৰ অসমৰ আছে. As per NFHS 5, anemia, okay, National Family Health Survey, anemia among women in tea garden belts often exceeds 70% anemia. 70%. Child malnutrition indicators are significantly higher than the state average. My question is, যোনটো state average তাতকৈ বহুত বেছি তেওঁলোকৰ মাজত. Constitutional backing jodi ami sao, ami kyo teolokor kotha bhabibo lage. Article 21, right to life, includes right to health. Because they are Indian citizens, they are entitled to Article 21, they are entitled to Article 38 and 39. Okay, reduce inequalities and ensure adequate livelihood. These are DPSP, okay, Directive Principles of State Policy. So the onus is on the state government, although DPSPs are not compulsory, but they guide the government, okay. Article 46, promote economic, again, Directive Principle of State Policy, promote economic and educational interest of weaker section. Jodi tumalage ebilakor pora jodi society, Indian society ba Assam part lo jodi proshno poa, tumalage hoday mon koriba ba hoday tumalage monot hoba, tumalage ebilak constitutional backing or karone eta beleg section tumalage use koriba, automatically you will get very good marks. Okay, dhora tumalage likhila nohoy je ami kyo koribo lage, at the same time write about the constitutional backing, he part to humwai diba hoday. Consider the following statements regarding the Assam Fixation of Ceiling of Land Holdings Amendment Act 2025. The amendment enables residential land allotment to tea garden workers living inside tea estates. The amendment enables residential land allotment to tea garden workers living inside tea estates. There's nothing wrong with this. It is right. The act mandates tea planters to increase wages before land transfer. There is nothing like this in this particular act, so I am crossing it. Over 3 lakh tea worker families are expected to benefit from the land settlement. Moi apnalok koiswe, okay, 3 lakhot koyo odhik sa janogostiyo mulok luke ba tea worker families okole ei junto initiative yar pra labh uthabo boli ami akha koribo paru. Which of the above statements are correct? 1 and 3. So 1 and 3, B is the right answer. Okay, so B is the right answer. Assam records sharp decline in cybercrime. Assam has witnessed an unprecedented rise in cybercrimes over the past decade, with 18,315 arrests since 2014 for offences ranging from online fraud to identity theft. Okay, online fraud to identity theft. However, recent reforms and coordinated digital policing have resulted in a dramatic, this is very important, 81.2% decline in cybercrime. And between a period from 2021 and 2023, okay, 2021 or 2023 or bhitor 81.2% hrash hoise, 81.2% decline hoise crime rates, mane cyber crime or rate. Despite this progress, significant challenges persist in investigation quality, conviction rates, and digital literacy. Okay, conviction rates mane ki pap eta kori dhuniya ke jage convict kora tekhetok case to register kora pa tekhetok mane justice dia loike. Okay, conviction. Okay, bohute tumar ki boli koy, bohute tumar crime to kori jai koy, they are not even convicted. Scale and nature of cybercrime in Assam. Cybercrimes bilak ki dhoroner cybercrimes ami sadharonote Assomot dekha pao. ATM fraud and KYC scams ebilakor kotha apnaloke shuniye thake hoy na. KYC stands for know your customer. Identity theft and forged documents, Aadhaar hok, PAN hok, SIM cards hok, voter IDs hok, identity theft mane apunar identity belege loi loi hoy na noy. Obscene content, okay, obscene content and child pornography. Edia identity theft hok social media to start hoy goise. Saboson kisman apunar friend list ot thokar sotteo ako ekejon manhoe apunak friend request pothiyai thake. So ketiao accept nokriba. Suppose agor manujonor কি বুলি কয় প্ৰফাইলটো আছে নাই, যদি অলৰেডি আছে তেখেতে কিয় পঠিয়াব। আৰু চাবাচোন বহুত সোনকালে হেজনজন অৰিজিনেল প্ৰফাইলৰ মানুহ তেখেতে কিছুমান পোষ্ট দিয়া আৰম্ভ কৰে যে মোৰ নামত কোনবাই ফেক একাউন্ট খুলিছে। So all these are cases of identity theft. Obscene content and child pornography, okay, all these are also rampant. Online financial fraud to hoye thake. Social engineering based scams, okay. Reasons for rising cybercrime. Reason ki rapid smartphone penetration, sobore hate hate, okay, sobore hate hate smartphone. Surge in online financial transactions, ami janue jodio digital India is a very good step. Like every other thing, digital India has also got its own downside. This is one of the downsides of digital India. Online financial transaction bari goise bahut. Organized cyber fraud networks, increased social engineering vulnerability, and weak digital hygiene and low cyber awareness. Okay, আমাৰ অসমত সাইবাৰ এৱেৰনেছ বহুত বেছি লো, মানে যিসকল মানুহ ক্ৰিমিনাল মাইন্ডেড নহয় তেওঁলোকৰ সাইবাৰ এৱেৰনেছ বহুত বেছি লো। তেওঁলোকে নাজানে যে আমি সোশ্যাল মিডিয়াত থাকোতে কি কৰিব লাগে বা অনলাইন থাকোতে আমি ডুজ এণ্ড ডোন্টস বিলাক আমাক কেতিয়াও মানে হেতু আমাৰ ব্লেম বুলি নহয়। Okay, the effort should be initiated by the government. আৰু আমাৰো এটো দায়িত্ব যে আমিও নিজকে aware কৰিব লাগে about cyber crimes, about the nature of cyber crimes, how to prevent those things from happening. Government and institutional measures, reporting and response. In 1930, National Cybercrime Helpline mane 1930. Okay, so 1930 is a national cybercrime helpline for quick fraud reporting, faster freezing of fraudulent transaction. Okay, so if you ever become a victim, God forbid, if you ever become a victim of this, just dial on this number instantaneously. Police policy measures, implementation of the National Cyber Security Policy in Assam. National Cyber Security Policy অসমতো implement কৰা হৈছে, focus কৰে detection, response, resilience and prevention ওপৰত. Institutional strengthening, National Cybercrime Coordination Center and CCC for interstate cooperation. It is an institution, very important, National Cybercrime Coordination Center and CCC. And CCC, National কি কলো, National Cybercrime Coordination Center কি কৰে, interstate বেলেগ statesৰ মাজত cooperation to enhance কৰে, তেওঁলোকৰ এইটোৱে role. CERT, okay, this is again a very important institution by organization. CERT in enhance to respond to cyber threats faced by institutions and citizens. Our CERT in apunar Meite junto Ministry of Information Technology tar under ta hai. Strengthening of Assam Police Cybercrime Wing and District Units. A reform bilakor prabhav kenuka dhoronor prabhav porise ami etu janibo lagibo. Cybercrime cases reduced from 4,846 2021 ot asile 909 hoy gol 2023 hetu ke ami more than 80% boli koisilu. A national level digital hetu reset, national level digital reset. Increase in preventive blocking, quicker response and surveillance mechanisms. Aru etiao persistent kisman challenges etiao ase. Weak criminal justice outcomes, charge sheet rate 14%. Okay, NCRB, okay, National Crime Register Bureau 2022 mote 14% charge sheet rate, kintu conviction rate is just 4%. So look at the discrepancy between the charge sheet rate, charge sheet file hoise kintu conviction rate is just 4%. Okol 4% ok ami convict koribole hoikyam hoisu charge sheet file hoar pisodo. Okay, it is among one of the lowest in India. We need to improve on this. Nearly 90% cases pending trial. Okay, this is again, we all know how much of a pressure our judiciary is under. Almost 90% of the cases are pending trial. Trial e arambho hua nai. Operational issues. Many offenders operate outside Assam. Cross-border jurisdiction challenges. Ebilako ahi jay. মানে যোনবিলাকে সাইবার ক্রাইম কৰে, many offenders are operating from outside Assam, so cross border এটা চ্যালেঞ্জ আহি যায়, এইবিলাকে কৰাত সহায় কৰা আছে ইনষ্টিটিউশন মই কৈছোৱে. Slow investigative processes, delay in evidence collection. Okay, obviously Indian judiciary কি কয়, you need evidence. Lack of trained cyber forensic manpower. যিসকল এক্সপাৰ্টছ আছে, বহুত এনেকুৱা এক্সপাৰ্টছ আছে যিসকলে প্ৰপাৰ ট্ৰেইনিং লোৱা নাই, বা যদিও লোৱা আছে, we need more such people. Manpower is very low. Okay, trained cyber forensic manpower ক্ষেত্ৰত manpower is very low. Way forward, invest in specialized cyber forensic labs and trained investigators. Okay, we need more trained investigators, not just আমি আহিছো কি বুলি কয়, আমি just আহি পেলাই ইনভেষ্টিগেট কৰিবলৈ আহিছো. Okay, আমি CID আমি ইন্সপেক্টৰ প্ৰদ্যুমন হ'বলৈ আহিছো. So strengthen interstate and international coordination. Interstate बढ़ाबो লাগিব coordination আৰু international coordination बढ़ाबो লাগিব. Speedy justice through fast track cyber crime courts, especially amak special courts lage, fast track. Okay, we need a certain number of courts which specialize in what? In cyber crimes. Fast track court jate justice gets speedy. Expand digital hygiene education in schools, panchayats, SHGs. Promote public participation, community cyber vigilance lage. So I had a question now, we consider the following statements regarding Assam's cybercrime situation. Assam has recorded an over 80% decline in cybercrime cases between 2021 and 2023. This is a right statement, absolutely correct. The National Cybercrime Coordination Center assists in interstate cybercrime investigations. This is also correct, nothing wrong with this. And CERT in functions only for government institutions and not for individuals. This is wrong, incorrect, because it also functions for citizens. So which of the statements given above are correct? 1 and 2. So this is correct. Etu khuddha. This is correct. Okay. So let's move on to the next and the last topic for today's session. Rising HIV infections in Assam. Apnaloke jane. So HIV, it leads to a disease known as AIDS. Context: Assam is witnessing a worrying rise in HIV infections. despite having a lower prevalence, 0.08% than the national average. National average kiman? HIV infection or 0.20%, kintu amar 0.08%. Okay, that way Assam is safe. But recently we have had a surge in HIV cases. Kyo? Recent data reveal an acceleration in new infections driven predominantly by injecting drug use, IDU. It is not by, it is not by getting engaged in unsafe sex or something. It is by the use of this, okay, injection and drug use. Experts warn that HIV in Assam is becoming endemic, requiring a shift towards integrated health system responses. Etia ami olop amar approach to holoni koribo lagibo, because okay, this rise is not attributed to unsafe or unprotected sex. This rise has been attributed to something else, which is known as what? IDU, injecting drug use. Okay, that is very dangerous. Current situation in Assam. Key stats. 35,000 plus people estimated to be living with HIV. 7,274 new cases detected in 2023-24 alone. 7,274 new cases. By November 2025, 19,030 general clients tested HIV positive. So, 19,030 general clients and 1,811 pregnant women tested HIV positive. Okay? Shift in transmission pattern. Earlier, heterosexual transmission dominant. Okay? Heterosexual transmission dominant. Moi junto kolu. Okay? Heterosexual transmission dominant. Kintu injecting drug use accounts for 65% of new cases in the past 3 years. This is very dangerous. Okay, this is also a factor. I'm not saying this is not at all a factor, but the most important factor is because 65% of the cases, okay, are happening because of injecting drug use. Likely underestimation due to rising drug using population. Large-scale heroin, yaba and, methamphetamine seizures and cross-border trafficking networks. Why Assam is highly vulnerable? This section is very important. Why Assam is highly vulnerable? Because Assam is known as the gateway to the northeast. Transit and trafficking corridor. Assam is also used as a transit as well as a trafficking corridor. So Assam or bisi adan pradan hoy. Okay, it comes into contact with a whole gamut of people. Okay, proximity to high prevalence states. Mizoram, Manipur and Nagaland, these are very high prevalence states where HIV infection, the rate of HIV infection is pretty high. Okay, Mizoram, Manipur and Nagaland, highest adult HIV prevalence in India. Highest adult HIV prevalence in India. And all the 3 states, are very close to Assam. Okay, they are our neighbors. High youth mobility and migration to cities. So what happens is, youth from these 3 states, they often come to Assam, they keep coming to Assam, as a result of which, I'm not trying to stigmatize them, but I'm saying that this is a way, okay, for that particular virus to travel from those states to Assam. Large private healthcare sector attracting patients from the entire northeast. Okay, Assam is known for its major healthcare system. Of late, the government has paid a lot of attention. It has always been the topmost among all the other northeastern states. But this is also one of the reasons why people from other northeastern states, they come to Assam in such large numbers. Socio-economic and behavioral vulnerabilities among young populations. Okay, this is also a reason. Okay, public health concerns, increasing endemicity, HIV infections rising steadily, indicates shift from episodic outbreaks to sustained community level spread. Sustained, okay. It remains there, it stays there. Earlier it was an episodic outbreak. This is more dangerous than this. Need for systematic transformation. There is a need for systematic transformation. Experts stress, move away from vertical disease specific programs. Shift to integrated health systems approach. Okay, including primary healthcare, strengthening behavioral interventions and all. SDG 3.3 target challenges. Okay, Sustainable Development Goals, 3.3 target challenge. It ends to AIDS. It ends to end AIDS epidemic by 2030. It aims to do that. Requires what? 90% reduction in new HIV infections. It requires 90% reduction in new HIV infections and also 90% reduction in AIDS related deaths. Okay, it has got two components. These are the two components. Reality, let's have a fact check. Death reduction is on track. Okay, as far as death reduction is concerned, we are pretty much on track, but decline in new infections is insufficient. Decline in new infections is insufficient. We have to do a lot more in this department. Let's have a question. Consider the following statements regarding the HIV situation in Assam. Assam's HIV prevalence is higher than the national average. This is absolutely rubbish. This is absolutely incorrect. On the contrary, Assam's HIV prevalence is lower than the national average, 0.08%. Injecting drug use accounts for the majority of new HIV cases recently. This is correct. And SDG 3 aims to eliminate AIDS as a public health threat by 2030. This is also correct. So 2 and 3 are right statements. 2 and 3 are right. So B is the right answer. B is the right option. Okay. So thank you so much. Okay. So ধন্যবাদ থাকিল. Okay. আৰু মোৰ হৈতে আজিৰ সেশনটো কৰাৰ বাবে আপোনালোকক মই ধন্যবাদ জনাইছো আৰু আমি প্ৰত্যেক শনিবাৰে এনেকুৱা সেশন বিলাক আনি থাকিম যাৰ দ্বাৰা আপোনালোকে আপকামিং এক্সামস বিলাকৰ কাৰণে আসাম ৰিলেটেড যোনবিলাক কাৰেন্ট এফেয়াৰ্স সকলো ধৰণৰ আপোনালোকে সুবিধা পাই যাব. থ্যাংক ইউ, নমস্কাৰ, জয় অসম, টেক কেয়াৰ, সি ইউ अगेन নেক্সট স্যাটাৰডে.